My name is Jennifer Gossett, and I am the ADA 504 Compliance Manager at Portland Community College. In this presentation, we will be discussing lessons from COVID, retaining the good. Before we get started, I would like to offer kudos to my colleagues Rob Wallen and Lisa Meeks, who are co-authors of It Took a Pandemic: Enduring Lessons for Improving Accessibility in Medical Education, which significantly informed the content of this presentation. You can find our article in Disability Compliance for Higher Education's June 2022 issue. In March of 2020, the onset of the COVID-19 pandemic in the US presented major challenges for educational institutions. It was a major catalyst for change, as educators were forced to creatively re-envision education and new approaches. Out of the chaos rose a collective willingness to think creatively and adapt. Although this type of creativity had been used prior to the pandemic to develop accommodations for individual students with disabilities, these changes occurred on a larger scale and increased flexibility for entire cohorts and programs. In this presentation, I will discuss some of the challenges and opportunities for institutions who were able to keep their doors open through a global emergency. Throughout this presentation, I encourage you to reflect on changes that were made and consider what lessons may be applied in the future to realize the mission of greater accessibility for all students. Even though this presentation will focus on positive takeaways from the pandemic that we can apply to our practice, I also think it is critical to acknowledge how the pandemic presented serious challenges for many of our students. Here are some of the challenges which are important to consider and that must also be addressed to support our students and provide the most accessible education possible. During the pandemic, geographic and socioeconomic disparities further highlighted how lack of access to high-speed internet is an equity issue that many institutions were not prepared to address. In addition to internet access, institutions must consider that not all students have home environments conducive to learning, studying, participating in synchronous courses, and taking assessments. This may be a continuing challenge as institutions implement more flexible learning approaches moving forward. While mental health and well-being for students was already a concern prior to the pandemic, its impact resulted in a significant increase in the number of students experiencing depression and anxiety. One study published in the Journal of General Internal Medicine found that over 2/3 of medical student survey participants reported that their mental health had deteriorated following the start of the COVID-19 pandemic. Impacts on our students' own physical health or the health of a family member also pose significant challenges for many. The pandemic highlights the continued need for academic health science programs to prepare and deploy additional resources towards students' mental health and well-being. During the pandemic, the murder of George Floyd ignited global attention to police brutality and systemic racism in the US. Repercussions of the pandemic paired with police killings had a significant impact on the education of Black and Brown students. A new study by the Black Education Research Collective at Columbia University is the first of its kind to offer evidence to quantify the devastating repercussions of COVID-19 and police killings on the education of Black children in schools across the country, with a focus on 6 major metropolitan areas. The report is titled Black Education in the Wake of COVID-19 and Systemic Racism, Toward a Theory of Change and Action, and it offers an agenda for racial equity and key takeaways for educational systems to support student safety, learning, and success. You can read more about this research by visiting tinyurl.com/BERSLE/COVID. Many students also face significant financial challenges during the pandemic, impacting access to basic needs such as food and housing. These challenges, paired with rapid changes to delivery of education, resulted in the increase of the number of students with disabilities requesting accommodations. Additionally, the pandemic shined a light on two key concepts in the provision of accommodations for students with disabilities in higher education: universal design and fundamental alteration. Universal design is design that's usable by all people to the greatest extent possible without the need for adaptation or specialized design. This concept was coined in 1985 by Ron Mace, who was an architect with a focus on advocacy for people with disabilities. Many of the strategies utilized for education in response to the pandemic are illustrative of universal design. The pandemic also transformed the meaning of reasonable accommodation in higher education, because many of the accommodations previously denied to students because they were considered a fundamental alteration were granted to all students during COVID-modified operations. The Access in Medicine Group, part of the Docs with Disabilities initiative, recently created two video resources that illustrate both universal design and how we're in a whole new world when it comes to what is and isn't a reasonable accommodation. Let's watch.
In 2020, the rapid onset of the COVID-19 pandemic drastically changed the delivery of health science education. Educators were forced to think creatively and adapt, delivering curriculum and assessing students with more flexibility using virtual instruction. Prior to the pandemic, requests to attend lectures remotely, to record lectures, or to have alternative testing arrangements were often denied. These requests were often denied because the institution felt that the requests were fundamental alterations of the curriculum. A fundamental alteration is a legal defense for denying a disability-related accommodation request. A fundamental alteration alters the essential nature of the goods, services, facilities, privileges, advantages, or accommodations offered. However, in the wake of the pandemic, modifications to curriculum and assessment that were previously considered impossible became possible. Shifts in educational practice in response to the pandemic bore opportunities for all learners. Let's discuss some of the changes that may have been considered fundamental alterations. Providing remote lectures benefits all learners, allowing learners to create an optimal learning environment for them. It also provides flexibility, enhances the use of closed captions, allows for continual access to recordings for review and re-review material as needed. It also allows learners to create an optimal learning environment, one that is especially designed for their learning needs, where they can adjust the temperature, lighting, and use adaptive or assistive devices. Allowing learners to participate in clinical rotations remotely can benefit students with disabilities by reducing the need to navigate difficult or inaccessible physical environments or to traverse the wards during a flare of symptoms.
We're going to round on some patients now. Everyone has the option of following along or staying here and engaging via FaceTime. For all joining from our rural locations, be sure to use the raise hand feature if you have any questions. We're glad you're joining us today.
My arthritis is acting up today. I am going to do this round remotely. It's really nice to have this option.
When was the last night the patient received blood thinners?
Thank you, Joe, for the great question.
For learners with disabilities, remote testing can remove the often awkward process of going to a separate testing facility, which can leave learners feeling very othered and ostracized by classmates. Remote testing also allows the learner to create a testing environment that is best for them. This increases confidence and confidentiality. Finally, remote testing creates ease of access to accommodations and equalizes the experience. We encourage educators to use the lessons learned during the pandemic and create a new normal by embracing the benefits of universal design and providing a more flexible delivery of health science education. We can improve teaching and learning for all. More information and resources can be found on the Access in Medicine website at www.docswithdisabilities.org/AIM. Did you know that there are 6 million deaf and hard of hearing people in the United States, or that several thousand of them are either practicing healthcare providers or enrolled in health science programs? These individuals often encounter language barriers resulting from a lack of meaningful and effective communication access. communication access has declined during the COVID-19 pandemic. With many classes moved to remote learning due to COVID, deaf and hard of hearing students were left to manage learning via inaccessible video platforms. Worse yet, most captioning programs don't accurately capture medical terms. So, while the world is adjusting to these new norms, deaf and hard of hearing are being forgotten. But this is about to change. Some health profession schools started using auto-captioning, believing that auto-captioning provides equal access. However, auto-captions only capture 75 to 85% of medical-related content. This raises information acceptable to a future health provider's knowledge? The answer is no. Captioning is a universal tool, improving learning for all. In fact, a recent study across 15 major U.S. institutions showed that 50% of students utilize captioning when they're available, regardless of disability status. This is a great use of universal design of instruction. Remember, captions are a critical part of learning, but not all options work for each student. We believe that every student should have a specialized approach to access, including captioning. Visit us on Captions for Health Education, including a user-based experience chart today, and to find out which captioning solution works best for your student. And follow our ongoing project updates on the Coalition for Disability Access and Health Science Education website.
These videos, created in collaboration with the Coalition for Disability Access and Health Science Education, illustrate how some of the changes integrated into remote lectures are aspects of universal design that have the potential to benefit all students, such as having access to captioning, availability of recordings, ability to customize the learning environment, and a reduction in commute time, giving students more time for study and self-care. There are also assistive technologies that can be used in conjunction with lecture recordings. For example, transcription software with built-in note-taking tools that allow recordings to be transcribed and annotated so students can more easily create study materials adapted to their needs. Thoughtful course design implemented throughout the pandemic also brought an opportunity to infuse the principles of universal design, forcing big questions such as, what content is truly essential in this course? Must the delivery of content be in person? And how might the learning goals of this course be achieved in an alternative delivery format? These questions have the potential for instructional and curriculum designers to further leverage principles of design to increase learning and impact outcomes for students. A shift in the ways we provide clinical education was also born out of the pandemic. By providing experiences with telehealth and remote rounding, the pandemic helped prepare students for the future of medicine. There are also some trends born out of the pandemic that I think are important to consider in budget, resource, and policy planning, such as an increase in accommodation requests for remote participation. We are also seeing more students communicating with each other about the quality related to the delivery of accommodations and institutional processes. There may also be an opportunity for mentorship and destigmatization of the use of accommodations because of an increase in faculty and staff making accommodation requests. So how can we work together to mitigate negative impacts of the pandemic while leveraging flexibility? Some ideas include continuing to provide on-campus testing and study spaces for students who don't have access to those resources at home. We can explore the use of HyFlex or hybrid flex course design, which has advantages such as allowing students to tailor learning to fit their needs, whether they benefit more from a hands-on or independent approach. We can implement universal design solutions, especially for challenging accommodations, especially when it allows students to still meet their learning outcomes. Some examples may include providing all students with captioning, site licenses for assistive technologies such as text-to-speech, dictation, and note-taking software. And we can continue utilization of remote testing options. To promote true and full equal access, we must continue our work to remove structural barriers and provide additional supports, including access to technology, as well as mental health resources on campus. So how can we advocate for change? Some recommendations include connecting with on-campus partners such as your teaching and learning center to collaborate on projects. We can leverage research and assessment strategies to compare pre-pandemic to current academic outcomes, as well as analyzing potential cost benefits by using new tools such as remote proctoring. I believe that we must take a social justice approach by removing structural barriers and bolstering supports for mental health and basic needs resources. Through our work together, we can increase diversity and achieve the goal of full and equal participation for students with disabilities in health science education. Thank you for listening to my presentation on Lessons from COVID, Retaining the Good.
Now, a disclaimer. The information in this presentation is provided for general informational purposes only and may not reflect current law or regulations. The information in this presentation does not represent the opinion of Portland Community College, PCC. No information contained in this presentation should be construed as legal advice from the presenter, nor is it intended to be a substitute for legal counsel on any subject matter. No viewer of this presentation should act or refrain from acting on the basis of any information included in or accessible through this presentation without seeking the appropriate legal or other professional advice on the particular facts and circumstances at issue from a lawyer licensed in the participant's state, country, or other appropriate licensing jurisdiction.